Hi, my name is Shaini Narang. I'm an international yoga teacher and wellness expert. And join us for World Glaucoma Week from March 9th to 15th as our experts share vital insights and do's and don'ts on how to manage this sight-threatening disease called glaucoma. So, doctor, one of my relatives recently got diagnosed with glaucoma. Is it something related to blood sugar or something else?
Glaucoma is a disease which affects our optic nerves. Glaucoma is not a single disease, but rather a group of diseases. Increased intraocular pressure is the most important modifiable risk factor for glaucoma. It can occur in any individual. It can occur at any age.
So, why does glaucoma happen to a person? And can it happen to anybody?
There are certain risk factors for glaucoma, like people who have relatives who are suffering from glaucoma, or people who have high eye pressure, people who have high minus power or plus power, those who have past history of some eye surgery, those who have a history of some ocular trauma in the past, or people who are using steroids for some reason. They are at increased risk of developing this disease. So glaucoma can happen to anybody and no age is exempt from this disease.
Doctor, how will I understand if I'm suffering from glaucoma?
The disease is usually asymptomatic. That is, the patient is not able to understand that he is suffering from this disease. Only if the patient comes for a regular eye checkup, the glaucoma can be detected by the ophthalmologist. In most of the cases, there is no pain, there is no redness. When the patient comes for a regular eye checkup, the ophthalmologist, that is eye specialist, examines the patient, and from a detailed examination of the intraocular pressure, the angle of the eye, the optic nerve, the ophthalmologist or the eye surgeon is able to make a diagnosis of glaucoma.
Doctor, if someone is suffering from glaucoma, what type of medicines would you suggest?
When the eye surgeon suspects that a patient may be suffering from glaucoma, we advise certain investigations. These investigations are, one is an automated perimetry. So what happens in glaucoma is that the visual field is gradually reduced from the side. So the area of the vision is gradually reduced. So this can be graphically demonstrated by an examination which is known as automated perimetry. Number two, we can check the angle of the eye. There are basically various forms of glaucoma. In one form of glaucoma, the particular anatomical structure of the eye, which is called the angle of the antechamber, that is open, that's called open angle glaucoma. Another variant has this angle closed, that's called the angle closure glaucoma. So to differentiate between these two types, we do an examination which is called gonioscopy. After this, we can do another examination which images the optic nerve. This is known as the optical coherence tomography or the OCT, where we can observe which part of the optic nerve is getting thinned out. So these are basically the diagnostic tests apart from the intraocular pressure, from which we are able to diagnose that this patient has glaucoma, and we have to pinpoint what is the type of glaucoma this patient is suffering from. As we have discussed, glaucoma can occur at any age, like children can have, even newborn children can have a type of glaucoma which is called a congenital glaucoma or developmental glaucoma. Then adult patients can have primary open angle glaucoma, primary angle closure glaucoma, and various forms of secondary glaucomas. Secondary glaucomas mean that the glaucoma is secondary to some other eye disease. For example, use of steroids in the eye, trauma to the eye, past history of surgery, etc.
So, doctor, for how long one has to take the eye drops?
So once the eye surgeon diagnoses glaucoma, we have to treat this patient. There are various treatment options, and nowadays we have very advanced options coming up for glaucoma. So in most of the cases, we start treatment with eye drops. There are various types of anti-glaucoma medications which reduce the intraocular pressure, but one has to remember that we have to put these drops regularly in the fixed time that the doctor has prescribed, and the patient has to come for regular follow-up, because despite treatment, the pressure may sometimes go up or the visual field may deteriorate. So we have to intervene whenever any of these things occur. Then there are certain special forms of treatment like laser. So we have discussed one form of glaucoma is known as an angle closure glaucoma. So there we do one form of laser which is called a YAG laser peripheral iridotomy, and that's very effective in these patients. Then there are certain patients which require surgery who are not controlled with medications or laser. There we have to do glaucoma surgery. So there are basically two types of surgeries. One is called a trabeculectomy, where we create a channel inside the eye through which the aqueous humor escapes and the eye pressure remains under control. In some forms of glaucoma, for example, neovascular glaucoma, uveitic glaucoma, post-surgical glaucoma, or persons where one glaucoma surgery has been done but it has failed due to some reason, we have some other forms of surgery like various forms of glaucoma drainage devices like the Ahmed glaucoma valve. In addition, there has been some recent advances which are known as a minimally invasive glaucoma surgery. In patients who have mild to moderate glaucoma, there are certain new devices that are now available abroad and also in India. And with a very minimal incision, this form of glaucoma can be taken care of. So these are various devices like eye stents or some other technique like the Kahug dual blade, or some other operations like GAT or gonioscopy assisted transluminal trabeculotomy. So overall, we have various treatment options for glaucoma. What treatment the surgeon will advise a patient will depend on the type of glaucoma and the severity of the glaucoma for this patient. But I would like to emphasize that many patients, if they follow the instructions of the doctor, they do really well over a period of time, and we can preserve their vision for a good amount of time.
As you told, lifelong medicine is required. But the question is, will it cause any side effects?
So we have discussed that there are various types of drops which are very effective for controlling the intraocular pressure. But the doctor, before prescribing these medicines, ensures that you do not have any adverse effects to one of these drops. While most of these drops do not have serious adverse effects, but we avoid some of these drops in certain situations, like we avoid the beta blockers in patients who have a history of asthma or COPD or who have very low heart rate. Any of these drops can cause allergic reactions. They can cause redness, stinging sensation. If you have any of these adverse effects, do not stop this drop by yourself. You inform your doctor, and the doctor will take adequate care. He will change to some other medicine and he will check the pressure, and you cannot just you have to comply with the advice of the doctor, because glaucoma is a chronic and lifelong disease, and it has been seen that those patients who continue putting their drops regularly and who come for regular checkups, their glaucoma is very well controlled. Now, what are the things that you can do to
As a common person, what should I do to prevent or manage glaucoma?
So as we have discussed, glaucoma is a silent disease. It's called the silent thief of sight. So the patient immediately does not understand that he has any problem because he has no pain, he has no redness, he does not initially have any blurring of vision. But if the patient comes for a regular checkup, then by doing a thorough and comprehensive eye examination, the ophthalmologist will be able to detect that he or she has glaucoma. So for this, you need to go to a proper eye doctor. If you go to an optometrist shop or an optical shop only for the glass power checkup, then it is not sufficient. All the examinations of the eye that we have said, like a slit lamp examination, checking the pressure of the eye and dilating the pupils and checking the optic nerves, these are needed to detect glaucoma appropriately and to treat glaucoma if you have it. So regular eye checkup is absolutely necessary, particularly if you're above 40 years of age, or if you have a family history of glaucoma, or you have a history of any eye injury or a history of eye surgery in the past.
So, doctor, is it like one eye drop is sufficient to manage glaucoma lifelong?
Now, in many cases, or in most cases, we start with one drop, but over a period of time, many patients require multiple medications, and with the multiple medications, the patient has to come for follow-up. In every follow-up visit, we check the eye pressure and we check the optic nerve, and periodically we check the visual fields. From this, we are able to understand whether the glaucoma is stable or whether it's progressing. If it is stable, it is fine. You have to come for regular checkups. If the glaucoma is progressing, we first add more drops, and even then, if we feel that the patient requires more IOP lowering, then we have to go for the other surgical options like laser or surgery, as we have discussed. So to sum up, glaucoma is a disease. It is the most common cause of irreversible blindness in India and abroad. So in 2020, the statistics is that worldwide about 80 million people are suffering from glaucoma, and in 2025 the number is even more, and in India about 12 million people are suffering from glaucoma, and in India about 50% of these diseases are angle closure and 50% of these diseases are open angle. And it's very crucial that we detect this disease because of two reasons. Number one, it is asymptomatic. The patient is not able to understand that he has this disease. Only if he comes for a regular follow-up, a regular checkup, we're able to detect this disease. And number two, the damage to the optic nerve and the visual field that is due to glaucoma, that is permanent. Once the vision, the extent of the visual field that is lost, that is permanent, we can only preserve the remaining visual field. So to sum up, glaucoma is a disease that is very important to detect. Everybody should be aware of glaucoma. So we are observing the World Glaucoma Week in March, and it's our effort to increase awareness about this disease. You should come for regular checkup, and whenever you come for a checkup, you please ask the ophthalmologist that whether you have glaucoma or not. Doctor, what is my eye pressure? So this is the questions that a patient should ask in every eye checkup that he comes for. And as ophthalmologists, it is our duty to detect this disease and to treat this patient effectively. And today we have a lot of good options, both medical and surgical, to treat glaucoma patients, and most of our patients do well over their lifetime.
Thank you so much, doctor, for sharing your valuable insights. I'm sure it will be very beneficial for our audience.